Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Oral Thrush Guide to Eliminating Infection. Oral thrush, also known as oral candidiasis, is a yeast infection of the mouth caused by an overgrowth of the Candida fungus. /r/n/r/n. It is most commonly found in infants and toddlers who breastfeed, but it can develop at any age, often due to wearing dentures or having various health conditions, such as uncontrolled diabetes or leukemia. Treatment is centered around using antifungal medications. /r/n/r/n. This article discusses the causes, identification, and treatment of oral thrush. /r/n/r/n. Chernetska Getty Imagesrnrn Oral thrush is common in infants and toddlers but can develop to anyone at any age. It appears as a white coating on the tongue. /r/n/r/n. The infection is typically mild and doesn't lead to long-term adverse complications, but babies and nursing parents can pass the infection to one another if it is not treated adequately. /r/n/r/n. Oral thrush can be caused by many things and it may be alarming. However, it can usually be treated and managed by your oral healthcare provider. /r/n/r/n. The cause of oral thrush is an overgrowth of the Candida albicans fungus. The fungus isn't typically harmful, but it can lead to symptoms when it grows out of control. /r/n/r/n. Overgrowths of the Candida albicans fungus can be caused by changes to the microenvironment, including /r/n/r/n. While oral thrush can be acquired through oral sex in rare cases, it is not considered a sexually transmitted infection, STI, sometimes referred to as a sexually transmitted disease, STD. /r/n/r/n. Oral thrush can develop in people with a compromised immune system. Chemotherapy is also a known risk factor for developing oral thrush. /r/n/r/n. People living with underlying health conditions, such as diabetes or hypothyroidism, may also be more susceptible to oral thrush. People with compromised immune systems are also more likely to get oral thrush. /r/n/r/n. Being deficient in iron or B12 could also drive the onset of Candida overgrowth, as do viral infections, such as human immunodeficiency virus, HIV. /r/n/r/n. With treatment, symptoms should clear up within 2 weeks. Treatment requires the use of antifungal medications that can be applied topically as a gel or liquid or taken orally in tablet or capsule form. /r/n/r/n. There are several visual characteristics of oral thrush in the mouth that you can use to determine whether you need to see a medical professional for testing. They include /r/n/r/n. Oral thrush on the tongue will appear as a white coating. If scraped off using a tongue depressor, the underlying skin on the tongue will be red and inflamed. There may also be slight bleeding. /r/n/r/n. The throat will be red and inflamed in a person with oral thrush. It may also be covered in a white coating. /r/n/r/n. When the cheeks are affected, they will be red and inflamed. White and yellow spots on the inside of the cheeks may also be present. /r/n/r/n. Additional symptoms include /r/n/r/n. In infants, look for these signs of oral thrush: /r/n/r/n. Oral thrush can go away on its own, but only in mild cases. /r/n/r/n. The primary treatment is antifungals. Antifungals used can include /r/n/r/n. Nystatin and miconazole are typically used topically for mild infections, and they often take a long time to eradicate the overgrowth of the bacteria. /r/n/r/n. Oral fluconazole is used when topical medications do not eliminate the overgrowth. Systemic antifungals given intravenously or orally are used when systemic infection occurs, i.e., the infection spreads to the entire body, or if the infection is particularly severe. They include /r/n/r/n. Some newer drugs, such as antibodies, cytokines, and antimicrobial peptides, are becoming more readily available for treating oral thrush, but they have yet to be considered first-line therapy. This means they would not be the first drugs prescribed by a healthcare provider. /r/n/r/n. While you're taking the proper medication to get rid of oral thrush, you can help ease symptoms by switching to soft foods, avoiding hot or alcoholic drinks, and using honey as opposed to sugar or other sweeteners to lessen the pain. /r/n/r/n. The symptoms of an oral thrush infection will continue to worsen if you do not seek adequate treatment. The infection can last for months or even years. /r/n/r/n. In some cases, you may not experience severe symptoms of oral thrush, such as difficulty eating or swallowing, but will notice, as it worsens, that these symptoms develop. That's why it's vital to start treatment at the first sign of symptoms. /r/n/r/n. Sepsis is a systemic blood infection that can develop if oral thrush is not treated and the fungi manage to get into the circulatory system. However, this is a rare complication of oral thrush. /r/n/r/n. Even after treatment, oral thrush can return. This can happen if treatment is not strong enough, if the full course of antibiotics is not finished, or simply due to other risk factors associated with the onset of oral thrush. /r/n/r/n. Some factors that may drive oral thrush recurrence include /r/n/r/n. When you have oral thrush, it's essential to maintain oral hygiene. /r/n/r/n. To do so, gently brush your teeth and gums with a toothpaste that contains fluoride, avoiding the white spots in the mouth and tongue. /r/n/r/n. If you have a severe oral thrush infection that's causing pain in the mouth and throat or that makes it difficult to eat, you can, /r/n/r/n. Oral thrush is not typically severe, but if left untreated, it can worsen over time. The signs of oral thrush, such as a white coating or white spots in the mouth, redness, and pain, all indicate a need to see a healthcare provider. /r/n/r/n. Once diagnosed, oral thrush is treated using antifungal medications. The type and strength will be chosen depending on the symptoms and severity. To curb symptoms while waiting for the infection to clear, people can rinse their mouths using salt water, eat soft foods, and avoid brushing the white areas in the mouth while brushing their teeth. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.